This study was launched by ELN in 2020, March 2020. At the beginning of the COVID pandemic, we registered so far 863 patients with myelofibrosis, polycythemia vera, and essential thrombocythemia. These patients were collected and distributed in the first, second, third, and fourth wave, corresponding respectively to wild-type virus, alpha, beta, gamma, delta, and Omicron variants of concern. And the objective of the study was to describe the critical outcome and the risk factors of this infection. We observed three critical outcomes, including mortality, thrombosis, and bleeding. And we described the mortality that was particularly elevated, especially in the first wave, and declined progressively. And in the fourth wave corresponding to the Omicron phase of the pandemic, mortality is quite rare in these diseases. It accounts for 1-2% of patients. Therefore, mortality is not yet is not a problem at the moment in these patients. But there are some problems that can be associated with these diseases. For instance, we don't have sufficient data on vaccination of these patients. Actually, we have data on the antibody responses following vaccination. And we know that patients on ruxolitinib, actually, they have a poor response in terms of antibody. But at the moment, we don't have any data concerning patients' reinfections after vaccination. So we studied this in 600 patients. And we have two groups of these patients. One group that previously had COVID, and then were, for those who recovered, were vaccinated. And we have 287 of these patients vaccinated after recovery of the first COVID disease. Fortunately, only few patients develop a new COVID after vaccination. They got 2 or 3 vaccines dosing in about 60-70% of patients, so that the protection in vaccinated patients after a prior COVID is about 97%. Things are different for vaccinations in patients without a prior COVID. So you don't have, in these cases, an hybrid vaccination. So that in these patients, we have 200, more than 200 of these patients. To be precise, 231 of these patients. And we calculated the number of these patients who got a new infection, the first infection after vaccination. These are called breakthrough infections. 26 of these patients, 11%, needed to be hospitalized because they had a severe disease, a severe infection. And some of them died for COVID. So that in vaccination in patients with MPN without prior COVID disease can experience a bad disease. And when I say disease, I refer mainly to Omicron and also in some patients to beta variants of concern of COVID disease. So still remain a bad disease for a fraction of these patients.